So again, for those of you on Zoom, welcome. We are at UCF's downtown campus, which is also home to many of our community organizations, and the Orlando Sentinel is here. And I'm CEO and founder of Project Opioid, Andre Bailey, for those of you that don't know me. And we're going to be talking today, we're doing a community forum with a small audience around the overdose crisis. Even during this pandemic, which has consumed most of our lives for the past 15, 16 months, we know that we have to take time, especially today on National Overdose Awareness Day, to talk about the rising numbers of overdose deaths in Central Florida, and around America. We're seeing the number of those struggling with mental health issues, substance issues, and overdoses at highs we've never seen before. And so we're here to talk about that today. I think the most important part of this conversation, at least from my perspective, is to talk about, in today's 1-hour session, about how the overdose crisis has changed, it is changing, and it is accelerating over the past 16 months. I actually thought a little bit about how the overdose crisis in August of 2021 reminds me of COVID-19, the virus, where we've struggled with COVID-19. We've built vaccinations based in laboratories at record speeds to battle this virus. Everybody lined up. You remember when some of us were fighting to get in line to get our vaccination. But then suddenly, CNN, the Orlando Sentinel, other news publications let us know, you know that COVID virus you were struggling with? Well, it's changed. It's morphed. Now we have something called the Delta variant, which sort of looks like the old virus, and it is rooted in the old virus, but it's not the old virus. The vaccine doesn't quite work. The old solution doesn't quite work on the virus the way the new virus, the way it did on the old virus. And so now, as a society with COVID-19, we see how a crisis can morph and change. And in some ways, that is, in my opinion, a great analogy of the overdose crisis, the epidemic in the middle of the pandemic. What was driving deaths before, we have data to show you that's not what's driving deaths now. The crisis has changed. Who is dying? Who is dying has changed. And our solutions are going to have to be different if we're going to save lives. So let me just take just a minute to give you guys some background information and do some introductions. Look at that, guys. Freaking gorgeous. You know me, but I'm so happy to have Mike Lafferty here, opinion editor of the Orlando Sentinel. Mike is such a treasure to this community, and he's going to be moderating the panel that will start in about 5 minutes. We also have distinguished guests here. I'll start here with Bishop Derrick Mcrae. Bishop Mcrae is the pastor of the Experienced Christian Center. He's also the president of the African American Council of Christian Clergy. He's a board member of Project Opioid. We're so happy to have you here, Bishop. We have Dick Batchelor, president and founder of DBMG Consulting. Dick is a community treasure. He was Central Floridian of the Year. I think the first year they had Central Floridian of the Year, but it was Floridian of the Year. Dick is one of the most well-known community leaders in Central Florida history, and so he has been touched personally by the overdose crisis. He lost his sister in this crisis, and so we're so happy to have him here today, and as a leader of Project Opioid. And then Dr. Philip Toll, Senior Vice President, Aspire Health Partners. I always say, not that Dr. Phil, the other one. But the better one. We like this Dr. Phil better. But Dr. Toll, in my opinion, is one of the smartest behavioral health experts in this community. He told me 30 days after the pandemic started, April of 2020, he said, Andre, he pulled me aside at a meeting. He said, we're about to experience the largest mental health crisis in the history of this country. We're going to see more people with post-traumatic stress disorder than has ever happened. This is the largest stress event in the history of the world. And it's broadcast in 3D on the internet and on television. And his words have proved to be true. Mental health in this country and really around the world and in this community is now driving this overdose crisis. So we're so thankful to have you here today. Those of you on Zoom, feel free to put questions in the chat box, or you can message us directly. Lisa is monitoring questions at projectopioid.org. And I just want to also welcome quickly, I would be remiss to not welcome our partners in Jacksonville. We have the North Florida partners, Jacksonville Chamber, Tampa Bay Partnership, Miami-Dade Beacon Council, Greater Fort Lauderdale Alliance, South Florida, Palm Beach County, all of our other Project Opioids around Florida. We welcome you for those who are attending from there. And thank you to our partners at Florida Blue and the Florida Blue Foundation for helping us all along the way. What do we do at Project Opioid? We bring people together, get data, and give data to people like Mike so they can make people do the right thing. So that's what this slide says. We bring people together and force change when change needs to be made. And we're about bringing together specifically business, faith, and philanthropic leaders to partner with government and other stakeholders. We believe that that's the answer to how we really make a difference on this crisis. So quickly, before we have Mike come up and begin the panel, here's what you need to know. 5 things quickly today on International Overdose Awareness Day. Number 1, the overdose crisis is changing and accelerating. COVID-19 has created the greatest mental health, substance abuse, and overdose crisis in U.S. and Central Florida history. This chart is directly from the Department of Health. It shows what is over a 70% increase in deaths during the peak of the pandemic in 2020, with those numbers leveling off between 40 and 50% increases in deaths in every county in Florida during this pandemic. 2021, we've seen those numbers go even higher. Seminole County, as one example, because Sheriff Dennis Lima has such quick access to his data, their overdose deaths in 2020 rose 37%. In 2021, up another 17% from that historic high. So, and 5 things we want to know as we begin this panel. Number 1, the overdose crisis is accelerating during the pandemic. If you're on Zoom, you can screenshot this and share it. We'll put these in the chat as well. You're seeing huge increases across Florida, and we believe when the final numbers are tallied nationally, over 100,000 people will have died of overdose in 2020. By far the highest number we've ever seen in American history. Number 2, this is probably one of the most important things we have to discuss. The crisis has changed from a prescription pill crisis to an illicit fentanyl crisis. Listen, we all know the story of Purdue Pharma. We know the story of the Sackler family that for 20 years dumped billions of OxyContin pills on unwitting Americans and pushed doctors to overprescribe these drugs. And so many thousands of Americans in communities across this country were hurt by that overprescribing. But what we've seen, what the data shows in 2020 and 2021, is that prescriptions of opioids written by doctors, given at pharmacies, are down 70%, but deaths are up almost 40%. What does that mean? Does it mean it was a bad thing for us to reduce prescription opioids? We're not saying that. Although if someone needs prescriptions to an opioid because of chronic pain, we have to have that conversation. And it's a wonderful thing every time we take away a prescription from a first-time potential opioid user. But I've sat like you have sat in so many leaders' offices who say the answer to this crisis is taking away prescription opioids. I'm afraid that this panel and other leaders around Central Florida and around Florida and America are going to have to look at much more complicated solutions than just taking away prescription opioids. And fentanyl is now the drug killing 80 to 90% of every person dying. Fentanyl is created in clandestine laboratories, otherwise known as basements in Mexico, and is now the drug that the cartels are flooding across the border. It's in every street, on every corner in America. Number 3, mental health issues. That is what is driving this crisis. You're seeing people turn to alcohol, other substances in the highest numbers we've ever seen. But those that are experimenting with street drugs, fentanyl is killing them. I had a mom tell me 2 weeks ago, I want everyone to know my daughter was not addicted to opioids. She just went to a party and took the wrong pill and she died. That's not what we saw before with this crisis. 4th, and this is so important, the highest percentage increase by far over the past 2 years in deaths has been in the Black community and the Latino community, as we continue to see a historic rise in deaths among rural Americans as well. This is brand new. In Florida, during the height of the pandemic, March, April, May, and June, the death rate among Black Floridians rose 110% in 1 year. That's never happened before. Why is that happening? And what is the correlation between those who maybe, and it gets a little controversial for those that don't want to have an ear to hear, but what is the correlation between Black Floridians, Central Floridians, Latinos, and rural folks who don't want a vaccine, who agree on nothing political, Bishop? They don't agree on anything political at all. But you know what they agree on? Don't get a vaccine and don't get help with mental health issues or substances if you're struggling. It's a fascinating and dangerous trend, and it's an issue of culture and trust. And now what we realize is it doesn't matter if we have all of the mental health services in the world, just like we had all the vaccine we needed. If communities don't trust our doctors, our hospitals, our government, they will not get the help if it's right in front of them. So we have to talk about that, and we will today. And finally, the pandemic is raging, but urgent action is needed right now. Why is it? There's a press conference every day in every community in this country about COVID-19, but the leading, and which is wonderful, but how do we add to those press conferences, to our top leaders' agendas, this overdose crisis, which is the #1 cause of death of those who are 40 years or younger in this community and around this country. So with those kind of key points, what can leaders do? I now want to turn it over to Mike Lafferty, Editorial Board Head for the Orlando Sentinel. Mike, thank you so much.
Well, you're welcome. And Andre, thanks for hosting this. We appreciate the work that you and Project Opioid do, and I appreciate this panel being here today to talk about this. I wanted to tell you a little bit about how I was going to conduct, or plan to conduct this. I have some questions that I'll ask each of you, but with each of the questions, I would like for you all to just have a discussion, so that I'm just not sitting up here rattling off a bunch of questions, which I'm not averse to doing, but probably isn't the best format here. So we'll do it that way. So one thing, I guess the way I wanted to start was, this problem of crisis of opioids is a lot of times talked about in the abstract. Data, which is important, and statistics, which are important, and politics, which are important, but it's also personal. So I wanted to start this by asking each of you, if you're comfortable, talking about, if you have one, a personal experience, and I don't mean yourselves, but maybe someone you knew or someone you loved who had an opioid addiction, and maybe just tell us a little bit about that so that we can make this something more personal than just a discussion about numbers. So, would anybody be comfortable starting us off doing that?
I'll be happy to. Please go ahead. I've been with Aspire for 20 years, and my first position at Aspire was the outpatient clinical manager and clinical manager of what was then the methadone clinic. And what was it? Was a client of ours that on Tuesday we admitted both she and her husband for services. They were ready to change. They were ready, to stop the substance dependency in their lives. And both committed. Tuesday started on the methadone and doing really well. And on Saturday, a friend of the husband's came to town. So it was like one last time. Let me party one last time. And it was one last time because she woke up and with the dead in bed with her. And that's all it takes. And that's what's really key. Is that it's just maybe one time the young lady who went to the party and she overdosed. So that's really significant to understand. Is all it takes is one time, and it really is reaching into the lives of all of us on every level.
Mm-hmm. Yeah, absolutely. Anyone else?
Well, Andre alluded to it, and I did not intend to mention it when we had our first kickoff, so well over a year ago. But my sister, my youngest sister, was getting prescribed Andre said about fentanyl. I mean, that's what's causing the death. I mean, if you've got, thankfully the legislature responded years ago to the pill factories and closed them down and reduced and really restricted the prescription opioids. But as Andre said, prescriptions are down by 7%, but deaths are up by 40%. But it's fentanyl. And I want to try one more thing. I'm going to be going on the edge here, which I'm prone to do, is that in the Hispanic and African American communities, particularly African American community, and Bishop might correct me if I'm wrong, but opioid crisis at the beginning was a white man's disease. Where were we during the crack epidemic in the black communities? Didn't pay as much attention to it as we are now in this community. But now that you've got fentanyl, I mean, a very deadly drug, as I understand, 100 times more powerful than heroin, that's really driving the sales. It might not be opioid, it is opioid laced with fentanyl, but it could be another medium to transport the fentanyl to kill you. So there's a lot of discussion we need to have in all full candor, but where are we today and what can we do? But I wanted to make those points on it. But I think of my sister every time I hear the story. So yes, I have a personal experience and one that will stay with me obviously forever.
Dick, what was her name?
Betty Faye.
Betty, how old was she?
She was 66. Very young. Very young.
Thank you for talking about that. We appreciate it. Anyone else?
Yeah, from my standpoint, nothing personally from my family, but in the profession in which I work and still with families who have dealt with this, and anytime it comes down to us preparing now for that final arrangement of the services, and seeing just the trickle-down effect that takes place as it affects so much more. I know sometimes we think about our home, but we don't think about our community as a whole. We don't think about the other individuals who are in contact, communications, and how it affects, and then how it also affects generations. So you're talking about legacies, you're talking about, especially with it being much more at one point in time with the older individuals who are kind of getting attached to this. It was having a trickle-down effect to the kids, to the grandkids as well. And now we're seeing those same individuals who are wrestling with the same demon, for lack of better word, that some of the more seasoned individuals used to wrestle with, because of the fact of what their fathers and their grandfathers went through. And so now they're wrestling with it because this was their mechanism used to try to cope with their stress. So this was something that was given to them as well. And so we have to be very mindful that it's not just an issue that happens within a house. It's an issue that happens within a community, and it gives a different tone and temperature to the entire community. And I've seen that personally. As I work to counsel, to lead, to encourage, to give a sense of hope to a community that is, especially an African American community right now, it's a community that is filled with letdowns, distrust that is taking place, that it's hard for us to believe anything. But what we once believed that we could believe in is also what we can't believe in.
Mike, can I make a point too? And I think oftentimes you said, we have these very clinical studies and very abstract information, and it's well researched, it's empirical data, it's great, but put a face on it, right? And put a face on it, the people that you know, the people who are the collateral damage. I want to talk about, we could segue to Dr. Phil on what can we do about it. Look at the collateral damage. Look at these children who might be in a household where someone is not only addicted to opioid, but with the fentanyl application to it. What happens to that family? Is a family unit, the distrust, is there anger involved, is there abuse involved? But the collateral damage of these children, we cannot overlook that. So when you talk about looking at it from a mental health perspective, which I think is absolutely the top priority, how do you do that as a family unit though? Because you've got the user or the abuser, but you've also got, let's say, the husband, the wife, and the children, the collateral damage, and they are going to be affected. Last thing I'll say, you hear a lot of discussion now about ACE, Adverse Childhood Experience. And it's kind of new, but it's not. It's really kind of logical, and that is, there are 10 adverse childhood experiences that you can chart. One of them is domestic violence, child abuse, neglect. The emotional neglect sometimes is more preponderant than the physical abuse. But let's take that. Let's say that's going on in the household. So if we don't rescue these children off of this kind of refuge, that adverse childhood experience, if not addressed, will manifest itself time and time and time and time again, either with the drug overdose, the neglect, the emotional neglect, the abuse. So we do have to address the whole family unit, if I might call it that. I believe so, Dr. Phil, but you're the expert. Not the other Dr. Phil, but you're the expert.
Well, you're talking about systems. So taking a look at the system itself, and the primary system is the family. And so those adverse childhood experiences not only add to mental health concerns, but also physical concerns. More than 4 can actually lead to a major chronic medical illness that could last a lifetime. And so the real key there is what is happening to the family. So you think in terms of neglect, and it can be benign neglect because the parent is under the influence of a drug. You know, I can't attend you. Did you get breakfast this morning? Do you have clean clothes to wear to school? What's your emotional needs? Are those getting met? Did you have a difficult day? So that parent's not available because of the substance use or the chronic mental health condition that really leads to that neglect. And then we create an environment for the development of illness, behavioral health care concerns for the child and for generations.
Let me give you one more story, and my staff texted me to remind all of you, there's no mics, so speak up. So, but let me give you one more story, and this might really come back to the 2021 overdose crisis and how it's different than the overdose crisis 2 years ago, 5 years ago. And that's the story of Houston Spores. Houston, I put you on the spot, but wave to everybody. Houston is part of the team at Project Opioid, and I'll give you the short version of his story, but he was a football player, basketball player, and was given oxy and other drugs at too young of an age, wound up becoming dependent on them, and then had a long period of time where he was trying to get himself off those substances. He went down a few dark roads, and he tells his story much better than I do. But probably 7, 8 years ago-ish, he had this epiphany. He was going in and out of treatment, and he finally had that moment of clarity and got himself to a place where his treatment really took hold. And today he's married, kids, and works for Project Opioid. And it's a great story, right? Houston would be dead today if he had the same story. Guys, hear what I just said. The story's wonderful, and it doesn't work anymore. This guy, if he struggled today, would not live because fentanyl would not allow all those relapses. They would not allow him to, because you relapse on alcohol 20 times, and what happens? You ruin your relationships, you get fired from your job, but you don't instantly die. Houston's story is such an amazing story, and it's not applicable to 2021 because you die before you ever get a chance to have a second, third, or fourth opportunity. My friend, that story, in my opinion, I love you, Houston, thanks for letting me share your story. That encapsulates how we can't think of the overdose crisis like we thought of it before. We have to think about keeping people safe on a journey, keeping them alive. As Dr. Aaron Wall says, Mike, dead people don't recover. Dead people don't recover. And so 2021, we've got to think differently about how we keep people alive with fentanyl killing 90% of the people in our community who are overdosing.
Well, Dr. Toll, I'm going to ask you, and everybody else, please jump in after he's finished, but you're with a company that provides mental health services on a large scale. I'm curious if you could tell me what, from a standpoint of people who have opioid addictions, how 2020 and 2021 so far at least have looked differently when it comes to those people who are struggling. What effect has the pandemic had on people who are addicted to opioids? What's that look like in your facilities?
Well, number one, a massive impact and just an increase. When we take a look at substance use disorders, often is self-medication. So I'm in pain, I'm in discomfort, and as human beings, we don't deal well with discomfort, so we want to medicate it. Make it go away and make it go away fast. And addiction is a brain disease. And so when we start using, whether it's a physiological addiction or a psychological addiction, opiates, alcohol, benzos, which are prescription medications, are physiologically addicting as well as psychologically addicting. And so when with the pandemic, the resources that we had to cope with stress, to decrease our pain and our discomfort went away. They just weren't available to us. The things that we could go outside our home to do, and so they weren't there. So resources vanished, literally vanished, and access to care literally changed overnight. 65% of our workforce went to telehealth in 3 days. We went from providing 1,000 telehealth sessions in March of 2020 to 22,000 in April of 2020. And so, so the increase in the rise, in the pandemic in the early days was like, what the heck's gonna happen? No one has lived through this experience. No one has the resources, no one has the skill sets. So if I went through something as a child with trauma, and maybe I became, a support in like AA or NA, people have lived through it. We didn't live through the pandemic. We didn't have the skill sets. We didn't have the knowledge, the fear, the unknown. So that pain, that discomfort rose greatly with no one to turn to manage it, and substances were there. So increase in use, increase in overdoses. I mean, I can't tell you the number of clients we use Narcan today versus 3 years ago. Amazing. I mean, almost on a daily basis, and certainly on a weekly basis. Right there in the parking lot of our detox facility. They're coming in for treatment. We're having to use Narcan in order to, keep them from dying on the spot. And so that's significant. And then the amount being used has increased dramatically. So there are a number of people increasing, not enough. When we have, access is key. And with substance use, immediacy is key. I can't wait till next week for an appointment. I can't, because what am I going to use again? Fentanyl may either. I can't wait. Immediacy is necessary. And while we have money, we never have enough money. Make sure you understand what I'm saying, that we never have enough money for behavioral health care. But the other kinds of things that interfere, do I have transportation? Does the state law allow me to do, so like for our medication-assisted treatment, you have to do your intake at our central office. I might be able to give you, and we're about to be able to give you medication-assisted treatment out in East Orlando, and we're doing it at the jail, and we're doing it hopefully in Castleberry with our opening a clinic there. But only certain services can be provided there. So we need greater access, we need immediacy, we need to overcome those social determinants, transportation, access. Can I get away from the job? What are the hours? So it's not enough to have enough dollars to do it. We've got to have the access and the immediacy. It's got to be, when you're coming in now, it has to be now.
Mike, can I point out something as a follow-up to what you were saying? And that is, you mentioned there's a donor perspective. And so to that event, to that point rather, Orange County's like at the bottom of the bottom for mental health funding from the state of Florida, from the legislature, which also runs the risk of what will the legislature do when it gets this $1 billion plus settlement money from Big Pharma.
Let's not get too far ahead. I have a question about that specifically.
I was acting like Scott Maxwell. I knew the answer. Karnak.
Hold on to it for a minute.
Karnak, hold on.
Okay.
Hold on.
We're going to talk about
Okay,
that.
no
So
problem.
Once we get to the
To be
talk about
continued.
what should we do now?
Okay, thank you, I'm sorry.
1.6 billion, actually.
1.6 billion.
Yeah, right. Well, Dr. Toll, I'm curious, are you able to assign like percentage of, can you say there is a certain percentage of people who are receiving treatment for opioid addiction now where you can trace that back to the pandemic and to their, whatever sort of mental suffering people are going through?
I won't give you percentages, I'll give you numbers in our medication-assisted treatment. I say that specifically because the old days it used to be methadone. Now it's methadone, Suboxone, Vivitrol, all kinds of medications that really assist in the treatment of addiction, that really help reduce cravings and really can then allow you to engage in the other types of therapies that are effective. So our clinic, maybe 10 years ago, 200, today over 1,000 clients that are being treated in our medication-assisted treatment. And so that's a huge increase and a change in the availability. So there's so many more out there that need it, that need to overcome those burdens of getting access to care.
Well, that's another question I had for you was the question of availability. You mentioned transportation. Are you talking about that in the context of people being able to get down to get their treatment? Is that what you mean?
Yes.
Okay.
Literally, I mean, when you think in terms of Central Florida and Orlando, it's about an hour and a half trip on links.
And what else? What other sort of financial barriers are there for people getting treated for opioid addiction?
A big part of it will be, do they have private insurance available that will cover the costs? And and I may be jumping on a question later, but that parity, which you've heard me talk about before, equal expenditures for behavioral health care services as for medical services. That's federal law since 1999. Equal expense for behavioral health care issues and medical issues, and we don't have that. So there are limitations still in private insurance. It won't pay for detox. It won't pay for detox. It'll pay for a 28-day residential program. It won't pay for a 28-day residential program. There's no standard. So that's a barrier. Generally, by the time you recognize you need treatment, particularly for opioid dependency, you're in trouble with the law. You may have lost your license. You may not be employed. You may have any other kinds of issues that make it difficult for you to access the treatment facility. So for me, and I've been doing this for 42 years, it's like, let's take the service to the client. So let's remove the barriers of state laws and standards and say, okay, your intake can be, but all your individual therapy also needs to be at the central office. Why? We have telehealth, we have telephones, we have access. Access is key. So we need to eliminate all of those barriers, the socioeconomic barriers. I'm underemployed, or maybe I don't understand. And I would be neglect if I didn't talk about the stigma. And I said to someone earlier, we're still embarrassed and ashamed, even with our closest friends, to say, you know what, my wife's addicted. Because we still have that shame and that. And we need to overcome that and to recognize it's not a crime to become addicted. It's a disorder. It's a brain disease. And once we recognize it's a brain disease, none of us would shy away from supporting someone who had cancer, or who's struggling with diabetes, or who's struggling with MS. And yet we're very fearful of sharing that, oh, my wife has schizophrenia, or my loved one, my son, is bipolar disorder. We still stand back from that and not share that because of the shame and the guilt. So education is really key to say this is a disease, and we need to treat it like one.
Mike, let me just say this though, because I want to give you a simpler answer that I think every person in this room and every credible person I've ever talked to would agree with. When someone seeks help for substance abuse, they're dependent on opioids, they're in danger. It's really hard to find help. It is I see heads shaking in the back of the room. You call the hotline, you reach out to the number on the billboard that says call, we got help. My friend, it is very hard to get help. If you don't have insurance, it is even harder. And so this idea, I want to be real careful here because in my opinion, you've almost got like two big problems here. Number one, we've got a whole group of people who are most at risk, the Black community, the Latino community, people in communities like Bithlo that Tim McKinney serves in every day, who you could have all the treatment in the world, and they don't trust the Sentinel, they don't trust the governor, they don't trust the hospital, they don't trust the police, and so they're not going to reach out for help, even if it was offered. But then Bishop says, listen, man, don't let your son die of overdose. There's this Project Opioid, get him help. And they call some of the numbers. This is most communities in America, so don't just think I'm hating on this community. In most communities in Florida and in this country, when you reach out for help, it is not readily available. And if you do not have insurance, your odds of getting the treatment you need are little to none. And so that's, I don't know if that's the answer to the question you were asking, but I think you got to kind of start with that, because when you start saying, how are we going to reduce deaths? How are we really going to, 40% increase in deaths in 1 year? There is not enough people seeking help, and when they do seek help, we got to start by admitting that help is scarcely available.
Well, that's a good transition. I was going to move to you. I saw you nodding your head to some of the points that Andre is making. So what about this issue of communities of color being reluctant to seek help? And is that true for all mental health issues, or is it more true for opioid issues, or is there a way to distinguish those?
I think it's the truth overall. And I think that really stems from this distrust, because no matter who you are, the one thing that you hate is rejection. And it's really bad when you have certain insurances that are offered to you, but the insurance that is offered doesn't cover what you need. And so there's this blanket, where you have insurance, we're extending insurance to you, but this is not credible insurance, this is not what we need. And so the rejection component sometimes plays into the mental anguish that a person may have as well, where they start looking for places of support. And unfortunately, sometimes it's places that's not really helpful for them. So I think that this distrust piece needs to go a lot deeper. We have to start educating And not just through numbers. I think it's a total different situation when I say a number and when I say, like Andre said earlier, death. When I say, hey, you're gonna die from this, even with the fentanyl that we're talking about now, the numbers of death is not widely spread to my culture. So there's a conversation that happens on one end that sometimes never gets to another end. So it's not that we're not talking, sometimes we're just not talking in the right place. And then when we are talking in the right place, we're talking with the wrong people. So you have to be very mindful of the community ambassadors that exist in every community, Hispanic, Black, from your urban communities out to the biblical areas. There are certain people who have a credible voice, but we keep living in arrogance, shoving certain voices down to certain people. And let's be honest with that. We're doing it because of political motivations. Sometimes it's we're thinking about a vote more than we're thinking about a citizen. And so we want to shove certain voices, or we need somebody else to feel good so that more money can come into their projects. And so we're shoving a voice that represents a place for funding, but it does not mean it's changing a community. And we have to have shoulders broad enough that we can extend out to communities, ambassadors, and see how can we get them on board. But I think one of the challenges of getting those community ambassadors on board is the fact that those community ambassadors may challenge some of the systematic ways that we've already approached this, which requires them to stretch a little further and change, because there is no one way to function in all communities. We are different ethnic backgrounds. We come from different parts of the country, different parts of the world, especially in Central Florida. And we have to be mindful of cultures and different things for us, the rearing, the raising that took place in different places, and say, maybe I don't have the one cookie cutter mentality for it all, but I'm strong enough to listen to your voice to help me influence your community so we can get to the overall change that we really want.
You mentioned these ambassadors. Who are you talking about, and how do you get them on the same page so that they're doing what you're talking about?
Yeah. I'll tell you first who they're not, because I think we keep using them. Listen, when you talk about Hispanic populations, and I'm not Hispanic, but I talk to a lot of friends, and you talk about African Americans, we don't want to hear politicians. We mostly don't trust the ones we've elected. Okay, that's the first thing. They don't too much trust them, the ones that they've elected, because in most cases, our voting power did not actually elect certain individuals. So that's the first thing. We don't want to hear them. We don't want to hear big money corporations speaking to us, because we already feel like we're testing grounds, not actually carrying grounds. Who the Black population, the African American population, and the Hispanic population listens to a lot is the faith base. You know why? Because our faith has always stemmed back to generations before us. So if you look at any major move in the African American community, it has always been through the religious, faith-based sector. There is nothing on record that is actually working that did not start with faith-based. Even if you go back and start looking at Black Lives Matter, if we be honest, Central Florida is really a birthing place for Black Lives Matter. It started really with the Sanford situation that took place with Trayvon Martin. Who's at the helm of all this? Al Sharpton and Jamal Bryant, two preachers. So everything about us is all them. They're not the founders of BLM, but everything about us, going back to Martin Luther King days, and we're not even talking about just Christians. When you talk about Malcolm X, you talk about Muslims. You talk about Farrakhan, you talk about Muslims. So you have faith-based individuals who carry a voice in our communities that nobody else can carry the power to shift us into a position like they can. Because they have something they're grounded in outside of a situation. And that's how the African American community really thinks.
Let me ask you a follow-up question. You and I were talking a few minutes ago about vaccinations and how you've used your position as a person of trust in your congregation to encourage your congregants to get vaccinated, to save themselves. And yet, we agree there are other pastors who actually are totally on the other side of it. I've seen clips of pastors saying, don't get vaccinated, it's a mark of the devil, whatever. So I would
Those
imagine,
are non-reading pastors, though.
I would imagine that carries over to an extent to mental health issues, particularly with opioids. So you probably are not shy about talking with people about it, or maybe broadly talking to the congregation. But what about pastors who don't want to talk about it, who maybe feel like it's a bit of a taboo and don't want to touch it. How do you get faith leaders like that on board with the way you're thinking about it?
I think that you have to find like-minded relationships. So those who have a placement or opinion and also personal testimonies need to have transparent conversations with other faith leaders to tell them not just what to do, but why we're deciding to do what we do. Because if you find most individuals who are talking about the don'ts, they don't really have a platform for the why outside of, I don't really know enough about it. And so I think also the other piece is finding people who are relevant to now. Sometimes we're listening to leaders who are not relevant to today's time. They're not relevant to how things are going now. And if you're not careful, that will become your new place of leadership. But you have to find people who are really in tune with what's happening. Like some of the leaders, religious leaders, may not be in tune with opioid. They did not take the time out to learn this new platform or to study it. And so we have to get into people who are committed to the process of development, and then trust those voices to keep pushing our communities. And you won't ever get everybody to be on one page anyway. We understand that. We're trying to play for the percentages, for the majority, and hope that it overcomes those obstacles.
Like, let me give you one other thought on the faith community, though, because some people watching via Zoom might be like, the faith community, they're talking in trivial ways, you know. Let me give you just one other point on that, though. The idea is, what Bishop's saying is, in my community trusts me. I bury them, I marry them, I was there with them in their darkest hour. They know I'd go in the ground before I turn my back on them and lie to them. It's trust. In Tim's community, in Bithlo, he runs a school there. He's the head of a school, United Global Outreach, in the Bithlo community. It's about a different group of stakeholders. It might not be the faith community, but again, it's about trust. Who do you trust? And at the end of the day, Bishop got his vaccination rate, by the way, from 22% to 89%. And guys, it's just so weird how vaccinations have become political, and I'm not here to talk about that today, but I would just say this: if you don't look at the correlation between the idea that people would not, Bishop said something a second ago that really caught my attention. If certain people tell his folks to get vaccinated, that doesn't not only push them to get vaccinated, it pushes them not to get vaccinated. We are dying not just of opioids and mental health issues, we are a country and a community dying from lack of trust. And that's why leaders, whoever they are, corporate leaders, companies, to some people, their company is their HR department, their company, their boss, the closest person to them. So it's about at a community level. Here's the question: who do you trust? That's the person that's got to help you start a conversation and lead you to help and tell you it's okay if you're struggling.
And I think as important as who do you trust is say, how do you trust? How do you build trust? And that's the consistency. So I back my, just as you were saying, I got your back, I'll go to the ground before I not help you. And it's that piece, that consistency. So in the faith-based community, they're there every Sunday, every Wednesday, whatever event it is, just all of those things that Andre was saying. So it's building that trust, which is absolutely key. And the minute we violate that once, we've undermined that relationship.
Your clinic in Bithlo, you wanted to do that clinic forever, but it wasn't until Tim, who's in Bithlo every day for 10 years, brought it to the leadership of that community that they were open to doing it. That government, nonprofits, partnering at a community level. That's what we have to have.
So what I'm hearing, basically, we're really talking about humility. Let's be humble in our approach and how we're giving information out. It's the same thing that we saw with this vaccination process. If we would have gone about this differently from the beginning, we wouldn't have so much resistance in the middle. And I think the same thing is going to happen as we talk about Project Opioid. If we go about the right people, because watch this, the right person may not have all the knowledge, but they have the relationship. And we need to figure out how to partner them with a Dr. Field, who has all the knowledge.
There you go.
So that Dr. Field can be feeding that ambassador with what's needed, because that ambassador is the only one that's going to touch that community. And we have too many smart people who don't have relationships. And your money cannot buy a relationship.
So I kind of feel like we're moving into the,
Bishop is preaching, Mike, that's what's
yeah, I
happening.
know, I'm hearing it, I'm feeling it. So I feel like we're moving into the area now. What do we do about this? And again, I said at the beginning that sometimes these things seem abstract, and I would like, as much as we can, for you all to talk about in real terms. I'm hearing trust as a theme here. In real terms, how do we go about this? You know, what needs to happen? And I'm not talking about what needs to happen in theory. What needs to happen in practice?
Yeah.
So who wants to start with that?
I want to go back to Dick Batchelor's preemptive attempt to talk about $1.6 billion, because I do think, Mike, this is the most important moment on the overdose crisis in American history. Guys, if you don't really comprehend 40% death increase in 1 year, that's never happened with gun violence. That's never happened with any other issue ever. This is something unprecedented. But at that moment, Dick, now we have this lawsuit money in every state. In Florida, $1.6 billion. But as a state, as a society, we don't have a great history of spending that money on things that matter.
Okay, so your chance, Dick. Now that 1.6 billion is going to come over a period of years. It's not going to be
Right.
just one check.
Right.
And as I understand it, some large percentage of it, maybe like 85%, is supposed to be dedicated to, how do they call it, opioid remediation. So this is your chance. What should happen? You've been in politics. What should happen on a political level with that money?
I hate, as a recovering politician, I hate following the bishop here, because I'm not a politician, I'm a recovering politician, you forgive me. I've got some ground, not
Very little.
But let me make one point about what the bishop said is key. There's a term in marketing called borrowed interest. Borrowed interest is when you want to be seen with a product bigger than you are, right? You want to be seen, and that's what it's called in communications and communities, particularly in faith, that they borrowed interest. You want to borrow his credibility to communicate this issue to the community. It can't be a politician, it can't be a corporation. I understand that, and I think it's a very strong point to make, because we need to repeat it to ourselves, I think. But first of all, the legislature does not have a history of spending the money the way you're supposed to. They had $9 billion tobacco several years ago. Now I would have to say the Child's administration back then, I think, did spend the money the correct way. But the legislature is very susceptible to diverting monies for digital purposes. So I think we have to be very vigilant with the legislature and be sure that we've got the support there and communicate to them in every way we can that money was intended for the opioid crisis. That money needs not to be diverted, because they will do that. Now, I will say, as a salute to the Republican Attorney General, which might make her nervous, and it does me, that she's been involved in this as co-chair of the opioid task force with Sheriff Lima. So I give a lot of credit to the Attorney General and their efforts and their influence upon the legislature. But there are members of the House and Senate that have been involved in the whole mental health issue and all. So we just have to keep a focus and communicate to the legislature. We're watching. This money was intended for opioid crisis. And so to that end, we also need to fund Orange County mental health services. I mean, Aspire does a wonderful job. Central Florida Mental Health Association does a wonderful job. And they're actually communicating too. In fact, I'll tell you one example, if I might, Andre. You know, what they did, they had a $20,000 grant from the Central Florida Foundation. The daughter, who was 16 years old, was smart enough to say, "Mom, spend that money on TikTok." Now, I'm at the age I think TikTok's a grandfather clock. I have no clue about TikTok. I know it's out there.
Dick thought it was a breath mint.
I really did. So, she said $20,000. She has 400,000 followers in 2 weeks. So that's another thing I think we have to address. And you're very good at this in the technology. But the point is, people will receive the message, I think, well. In fact, the Mental Health Association, I think the motto is something like, you shouldn't be embarrassed to ask for help. Same thing about the opioid crisis. So bottom line is funding needs to be preserved. It's coming down to fine from the private sector or the federal litigation. the money's gonna be there, but we gotta be very vigilant to be sure that we spend that money for its intended purposes, not.
But I want to keep at what it looks like.
I want to give you a specific answer.
Okay.
I want to give you a specific answer, the most specific answer, and forgive me for bringing it back to the vaccinations again, but I think there's such a parallel that it's shocking. Guys, if you wind up in the hospital today with COVID and you die, 98.5%, if you were vaccinated, you're not gonna die, right? Like that, the numbers are overwhelming.
Right.
I think it was like 1%.
Right.
So, vaccinations, when you say, what's the solution to COVID-19? Vaccination, right? Is there any question in your mind, Mike? if that's
Not in
the
my
case?
mind.
So I wanna tell you this. There is an absolute 99% clear solution if someone is struggling with opioids. It's not up in the air, it's not kind of, sort of. It's the idea, if someone's struggling with opioids, you have to get them harm reduction. That's a very fancy term that we all like to use. Dr. Phil and I like to use this term to say we have to use medications to keep someone safe. There's a drug called buprenorphine. No one's heard of it, but ultimately it will help keep someone safe and not let them overdose if they're coming off opioids. That drug is cheap. We can get it to someone right when they're struggling with drugs, and then we can get them mental health services, even through telehealth now, or putting doctors, therapists in their community like Bidlow. Mike, the solutions are so clear, but again, the question is, will we put resources in them? And then will we put those resources in the hands of the community leaders, faith leaders, corporate leaders, who are the ambassadors that are trusted? But there are clear solutions, Mike, just like there's clear
Okay, well,
solutions.
I want to hear from Dr. Tolman and Bishop Mcrae about what are the contours of the solution to you? What do they look like? Dr. Toll?
Medication-assisted treatment is absolutely necessary with opioid dependency. There are physiological changes that take place. It's a physical dependence. Changes in the opioid receptor sites in the brain. I want to use, and opiates typically are in and out of the system pretty quickly, 4 to 6 hours. I'm using, I may have used more than I should have, now I'm high, I'm gonna go into withdrawal. It's when I go into withdrawal that I want to use again. So we end up chasing our tail, looking for the next opportunity to use. I can't possibly manage my life effectively if I'm chasing my next use of the drug. So I've got to stop that cycle. So medication-assisted treatment is the way to stop that cycle. I will not go into withdrawal if I'm on a medication-assisted treatment, which calms me down and allows me to address the issues that might have contributed to using in the first place. So I'm not chasing my tail. I can go back to work. I can re-engage in my relationships. I can be a contributing citizen to the community. And if there's no stigma connected to it, then I can be open about my use. But do I have to tell my employer, geez, I gotta be at the clinic at 5 a.m. because I can't be late for work? That stigma, we have to overcome that, and we have to recognize it's a disease. So medication-assisted treatment is absolutely necessary to break the cycle. And a year, no less than a year for those opiate receptor sites to heal, and maybe longer than that, depending on how long you've been using. But I gotta break that cycle with medication-assisted treatment. On top of that, it's gotta be the other therapies, and not just, insight-oriented psychotherapy as a licensed therapist that I am. It's what are the other determinants that contribute to making my life difficult? Good employment, keeping a roof over my head, good family relationships, all those things that all of us want, homelessness, everything that contributes to our struggle in this life overall, we need to be addressing. And so it's that collective model. Medication-assisted treatment will stop the craving. I promise you it will stop the craving. If you do it right, if you come to the clinic every day, or you take your Suboxone every 3 days, or whatever it is that's prescribed for you, the once-a-month Vivitrol injection, which works both for alcohol and for opiates, I can do that. Now let me take a look at the other things. How do I empower you to become, better employment? The case management model, it's more than just use. It's all those other things that caused us to use in the first place. And when we don't address those issues, then we're leaving them behind, and we're failing them in our treatment.
So Bishop Mcrae, I just handed you a $1.6 billion check. How would you spend it to solve this problem?
I would take up a tithe.
You gotta love Dick. I think the first thing that we have to do is football season. And so I kind of like to relate things to sports. So it's football season. We got to really define, we need to make sure we know who the owner of our team is. And then we need to define what positions need to be filled, from management to the roster. And then we need to have a game plan, because it's great to sit and have these conversations. But on the streets, do they know the game plan? In our communities, do they know the game plan? Talking about trust, I trust your history, and I also trust what you can present to me. So when I see A to Z, do I believe this is manageable? Because that can be one of the factors that gather trust. The other piece is, I trust Nick Saban to be a great coach. He says do something that makes no sense, but that's Nick Saban. We're gonna kind of do what he says, even though I can't stand Alabama. But he's gonna kind of do what he says. So I think that we need to gather together, similar to what we're doing now, but it has to become broader. We got to go find the people that we need to be on this team to say, you specialize in this, you're great at this, you're great at this. We break our huddles and we go run our play. If the play doesn't work, we come back together with the same personnel to see, this didn't quite work for us last time. What did you see? I saw this, that, and the other. Sounds great. Let's go run a new play. If the play still doesn't work, then we change personnel again. Because I don't think there's a one shot for this is going to be totally it. I think it's really a collaboration of people coming together, having conversations, talking about the resources that we do have, and learning who can spend where to bring about the best results. I love what Andre said earlier. He says, there is a way to do this, but does the common man know that? Back in the day, there was a strong commercial that went, this is your brain. This is your brain on drugs. And no matter where you are, no matter how old you were at that time, it sat in with you. And it showed you the effects. I don't think people intentionally do something to die. But I don't think they always know what happens to kill them. And we got to figure out how to communicate. If this happens, here's the likelihood you're dying. And put a real blunt statement out there. And don't try to sugarcoat it. Like really put it out there. Spend your money into the messaging. And the messaging sometimes means ambassadors. It means the media. Spend your money, because one of the things that we're struggling from, and I'm not trying to go back to vaccinations either, but one of the things that we're struggling from is bad messaging. I had a conversation yesterday. Well, I was telling you about that. I had a conversation with a loved one of ours, who I figured was quite equipped and educated, but her messaging about why she shouldn't be vaccinated, I finally broke down and said, so who's talking to you? And when I discovered who was talking to her, I said, so you don't have a doctor? And she says, yes. And I said, you didn't actually consider talking to the doctor? And she said, well, no, I hadn't got a chance to yet. Let's put the message out there so everybody understands truth, because there's so many lies. And we gotta be creative in how the messaging goes. It may not be through numbers, it may be through scripts. We may have to see certain things that play in our minds, subconsciously, that we see it when we're not even thinking about it anymore. But we got to overhaul messaging. So I would put money into messaging strongly.
I think we have a minute or two left.
For the Zoom audience, we do, but
With the Zoom audience, but I wanted to see if anybody in the audience, not our vast audience, it's about a half dozen people, if anybody out there has a question that they'd like to ask. Anyone? Never seen Tim McKinney with a loss for words.
Yeah, I think I agree with relationships are my thing, so I totally am echoing what you guys have said here, and I do appreciate organizations like Aspire who really are, on the front line trying to make things happen. But sometimes what we see though is with large organizations like Advent Health, like Aspire and others, we have trouble getting out into the community and making it happen. And I think the bishop might echo what we see in East Orange County is access is everything. So I agree with Andre to a point. Even if we had all the access, there might still be a barrier, but let's start with having all the access and see if people won't take advantage of it. So maybe not a question as much as a comment, but I think what we have to do is work a lot harder to figure out how to decentralize services and get them out into the neighborhoods that need the help the most. And so that's what I'm excited about partnering with Aspire on doing with our medically assisted treatment clinic and a lot of other resources coming. But we keep talking in such broad strokes like the state, Central Florida, and what we really need to talk about is these neighborhoods where we know the concentration of the problem is.
Andre, do you want to bring it home?
I would just say this, Project Opioid is so thankful for all the leaders that are working on this issue. And listen, we got to do more. It's unacceptable. I was on a Zoom 24 hours ago, is the last thing I'll say, and I was on with a mom who had lost not one but two sons to overdose death in the last 5 years, and she's got one more son, and she said that the only reason I can just wake up in the morning is I've got one last son that I can fight for and I can try to be an advocate for. There are solutions, but much like a lot of issues we're facing right now in Central Florida and across America, we're going to have courage, intelligence, and we're going to have to be willing to look at things that make us sometimes uncomfortable and empower with resources, trusted leaders in communities to see real solutions. There are solutions to this overdose crisis if we choose as leaders to try to bring those solutions to those in need. Mike, thank you. Thank you to the panel. Thank you to the Orlando Sentinel. We'll give you guys a round of applause.